bring your pet in at least once, maybe twice a year, and get a weight, a temperature, get a history on how he's doing, and he or she is doing. Also, we do a full physical exam, check the teeth, check the heart, check the limbs, check for lumps and bumps, diarrhea, parasites, ear infections. It's just a good way, it's just like your annual doctor's exam, to check for things that you as an owner may not know after seeing them every day, that we may notice that has changed over time with your pet. Depending on the age, every year or every 6 months. Absolutely, an ounce of prevention is worth a pound of cure. If there's any concerns about thirst or urination, if their appetite is increased or decreased, any stool abnormalities, vomiting issues, breath problems, mouth issues, lameness, limping, tumors, those types of things. A full wellness exam, we offer a canine annual wellness exam, which includes your exam, as well as an intestinal parasite exam to check for intestinal parasites, a heartworm test that will also include a tick-borne test. It's a small blood sample, and we also send a blood sample out to the lab to do a full organ panel, so they can check for your liver and kidney chemistries, your electrolytes, a complete blood count, to just get an overall picture of your, because they do hide disease, as well as there's only so many clinical signs that they'll show, and a lot of times they're only going to show symptoms when the disease is advanced. So it's a good idea to have a trend, know what your dog's normals are, and then if that trend starts changing, or if we do start showing changes in their blood work, then we can address it before they become symptomatic. Feed them a very good, well-balanced dog food diet, having 90% of their calories coming from dog food rather than treats. Brushing their teeth, keeping them on flea, tick, heartworm medications, as well as spaying and neutering, and being mindful of keeping them on a leash when they walk outside around other dogs. Even if your dog is well behaved, well trained, other dogs may not be, and that's when we get into trouble. Any medications that they're on, any stool samples, a fresh stool sample, that would be wonderful. I'm sure the dogs would appreciate that rather than us having to go after it. If they're having any urinary issues, your doctor may ask for you to bring a urine sample, but generally just any medications they're on and your questions and the dog. You should get an annual wellness exam every year to every 6 months.